Welcome back, everyone. Today we'll be talking about Therapeutics. We'll be talking about why it had a massive 51% drop today. We'll be also talking about the drug news related to the stock, and whether or not I will be buying the stock. So if you look at its 1 week chart, it is down 50% from that one day drop yesterday. The main news that happened was one of their drug results came back not too favorable. It had a mixed result, so therefore it went from around a high of 177 to 85. Now it's near its March lows. So is it a time to invest in the stock? Is my question. So what is Therapeutics? It's basically a commercial stage biopharmaceutical company. They essentially deal with rare diseases, and I'll try to explain why that's very, very important for certain companies like Sarepta. And I'll also be talking about why ARK Invest in this company and why it's on my radar as well. So the main reason why the stock tanked after hours yesterday was that their muscular dystrophy gene therapy drug had mixed results, which can lead to probably a 2 year delay, which is not very good news for a therapeutics company, especially when they deal with rare disease type things. The problem with the rare disease type things is that if they don't come up with a drug that solves that problem, that stock becomes almost invaluable per se. But if they do solve that problem, the stock would dramatically rise up. Sarepta has had success in the past. It was like a $4 stock and then went to 177. So you know that they have that potential, to keep skyrocketing up. But they need to get their drugs approved by the FDA first before they can make such a move. So I was reading more into this gene therapy drug and what happened, and I think honestly this 51% drop is a bit of an overreaction because I was reading it and they were essentially saying, "Oh, this is a delayed type situation, and it's not like we're disproving it or we're definitely not going to use it, but it's not to the results that we thought it was. Like it didn't lead to like statistically significant improvements, and it didn't lead to essential, sorry, non-essential type reliefs where their expectations were like, oh, it would be like a 40% improvement, right? 40% improvement, which is a lot, but instead it's like a 15%. I understand this is discouraging, but I think if they can work on that, they can have a pretty good work at it. But again, it is a devastating blow for any pharmaceutical or therapeutic company. The drug didn't show major improvements after a 48-week test, as said in this article. The increased amount of this drug in their muscle fibers only increased after 12, but after 48 weeks and 96 weeks, respectively, it led to no significant improvements in muscle function. However, if you were to go read a little bit more in detail, they had some sort of functionality. It wasn't that it was completely, insignificant per se. Um, Patients aged 4 to 5 did show statistically improved uh, muscle function. So the thing is that for youth, for the some of the youth, it showed improvement, while for some of the others, it didn't. And the problem is that these conclusions are indecisive, so therefore it is taken very negatively. Even the company CEO said we were disappointed with this. However, it's not a major letdown, but in terms of stock price, as you can see right here, it definitely is. Now I'm going to be talking about why and how ARK invests in this company and whether or not that'll encourage me to buy the stock. So as we see right here at number 37, Therapeutics is one of RG's one of their main holdings. I wouldn't say it's their number one or number two holding, but it is, in a long list, it is around 0.97. And today they added around zero point 0.8. So that makes it around, a 1.8, 1.7 holding. So, yeah, I thought that was kind of interesting. So now they moved it from 37 to 20. It's not updated yet because they just filled it today. So that's right under Alphabet Google in terms of ARKG, and ARKG is one of the best performing ETFs out there in the entire market, which is kind of insane to think about. So the thing is, if ARK has so much confidence in the stock and the data results aren't as bad as people think they are, I think this may be, a good opportunity to buy the dip here. They bought 0.7% of their ETF today. So the cash reserves that they had, they moved it to Sarepta Therapeutics. It's one of their biggest buys in terms of market value they've ever done in the ARK Genome ETF. So I thought that was quite interesting. But in terms of overall analysts, most analysts are still kind of bullish on this. I know a lot of analysts, I believe 3 or 4 analysts all downgraded their stocks from 160 to 120, or I believe one was 180, 190 to a 150. So I mean, it's not terrible. And they even said, "Oh, we're downgrading it because of this thing. We're downgrading it because of the failed gene type therapy." So I thought that was kind of interesting how they're addressing it and saying, "Oh, it's not much of a big of a concern." So I think we should buy the dip on the stock. Honestly, I have started a very small position in this, but if it does go sub 80, I'll keep adding more shares to it because I feel confident in ARK Invest and their thinking on the stock. So there you go, folks. I have a small position. I hope you enjoy this video and have a good day.